Good morning. You're watching News for Hearing Impaired. I'm Preeti. With me is Sonia. First, the headlines. The government amends FDI policy to curb opportunistic takeovers of Indian companies in the light of current COVID-19 pandemic. New norms state that an entity of a country sharing land border with India can invest only under the government route. Health Ministry says action taken on field level is yielding positive results as 45 districts in 23 states have also not registered any new cases in the last 14 days. Mahe in Puducherry and Kodagu in Karnataka have not registered any new cases in the last 28 days. Total confirmed cases of COVID-19 stand at 14,792, 488 deaths and 2,014 recoveries so far. Government clarifies that so far no decision has been taken to open domestic or international flight operations. Advises airlines to open their bookings only after a decision in this regard has been taken by the government. India continues to give helping hand to various countries across the globe in the fight against COVID-19. Kazakhstan and UAE thank India for providing medical supplies for treatment of patients with COVID-19. Three CRPF jawans martyred and 2 others injured in a terrorist attack in Sopore area of North Kashmir's Baramulla district. COVID-19 cases continue to spiral up globally with more than 23 lakh cases. More than 1.5 lakh people have succumbed to the disease. The Ministry of Commerce and Industry has revised the foreign direct investment policy in order to prevent opportunistic takeovers of the Indian companies due to the COVID-19 pandemic. Now, according to the revised policy, a non-resident entity can invest in India except for the sectors which are prohibited. However, an entity in a country that shares land borders with India can invest only under the government route. Any citizen of Pakistan or any entity incorporated in Pakistan can invest only under government route except for defense, space, atomic energy sectors and sectors prohibited for foreign investment. In the daily briefing held by the Health Ministry, the spokesperson of the ministry said that the field-level actions by union and state governments are yielding positive results. Mahe in Puducherry and Kodagu in Karnataka have not registered any new case in the last 28 days. A total of 45 districts in 23 states have not registered any new case in the last 14 days. Of the total 45 districts, 22 new districts from 12 states are recent addition. Dholpur and Udaipur in Rajasthan, Vishakhapatnam in Andhra Pradesh, Karimganj, Golaghat, Kamrup Rural, Nalbari and South Salmara in Assam are among these new districts. Lakhisarai, Gopalganj, added to that, other districts which have been reporting cases. We'll let you just know in that in a while from now. The Health Ministry had held a daily briefing of COVID-19 yesterday, and talking of the recovery rate, it stands at 13.85%. 2,014 people have recovered so far, while 488 deaths have been reported. The mortality rate due to COVID-19 in India stands at 3.3%. 45 districts across 23 states reported no new cases in the last 14 days. A new advisory has been issued for testing the methodology. Rapid diagnostic tests are to be used in hotspots, while rapid antibody test is used for surveillance and for epidemiological purposes to identify the hotspots. RT-PCR test is also the gold standard frontline test for COVID-19. Antibody test cannot replace this test. Civil Aviation Minister Hardeep Singh Puri said that airlines are advised to open bookings only after the government takes a decision on starting domestic and international commercial passenger flight services. The Minister of Civil Aviation clarified that so far no decision has been taken to open domestic or international operations. He added that airlines are advised to open their bookings only after a decision in this regard has been taken by the government. Earlier in the day, Air India said that it has opened bookings on select domestic flights from May 4th and on select international flights from June 1st. Union Home Minister Amit Shah reviewed the working of MHA control room and reviewed the COVID-19 situation in various states in a meeting with officers. The control room is operational 24/7 and is coordinating with states as well as with various ministries of the central government. Meeting of group of ministers over COVID-19 was held at Defence Minister Rajnath Singh's residence yesterday. Minister of Information and Broadcasting Prakash Javadekar, Railways Minister Piyush Goyal, Minister for Textiles and Women and Child Development Minister Smriti Irani and Food and Public Distribution Minister Ramvilas Paswan were present at the meeting among other ministers. The Defence Minister later tweeted, interacted with a group of ministers on the COVID-19 situation. We discussed ways to mitigate the hardships faced by people and the role ministries can play in providing relief to the people. The guidelines to allow limited activities and the measures announced by RBI were also appreciated. As India fights COVID-19 pandemic, Kerala's Kasaragod is setting an example in effectively containing the outbreak. According to the Health Ministry, out of 168 total cases in Kasaragod, 113 have already been cured due to proper clinical management. Not even one death has been reported from the area. Kasaragod faced many challenges such as due to foreign travel, geography and large number of expatriates. The district addressed the challenges well. It involved appointment of a special state officer for seamless coordination, tracking of home quarantine using geospatial tracking, break the chain campaign for promoting social distancing, use of drones. Over 17,300 contacts were traced and quarantined. Aggressive and quick testing was done in the district. Social welfare initiatives were undertaken to ensure that poor and needy did not face any troubles. Free food was given. Regular health checkups were conducted in Kasaragod district. Thanking Prime Minister Modi for sending medical supplies to Kazakhstan to help the country fight coronavirus, Kazakhstan's President Kassym-Jomart Tokayev said that India's gesture to help in such times is a mark of friendship and solidarity. The United Arab Emirates has announced procuring 5.5 million pills of hydroxychloroquine, a medicine found to be effective in treatment of coronavirus, from India. In a tweet, the UAE embassy in New Delhi said, under the guidance of UAE leadership, UAE Embassy India succeeded in obtaining the approval of the Indian government to export adequate quantities of hydroxychloroquine to UAE. It further tweeted that the first shipment of the medicine, currently on its way to UAE, includes 5.5 million pills for treatment of patients with COVID-19. We highly appreciate the cooperation of the Indian government in facilitating the procedures for obtaining the necessary approvals. The CRPF troopers were martyred in a terrorist attack in Sopore area of North Kashmir's Baramulla district yesterday. Suspected terrorists opened fire on a joint party of CRPF and police at Noorbagh near Ahad Bab's crossing. Several paramilitary troopers sustained injuries and were evacuated to the nearby SDH hospital. 2 CRPF personnel were injured in the firing, in addition to the 3 who attained martyrdom. Meanwhile, on the LOC, Pakistani troops yet again violated ceasefire by resorting to indiscriminate and unprovoked firing on the Indian forward posts and civilian areas in the border district of Poonch yesterday. Defense spokesperson told DD News that at about 8:30 p.m. yesterday, Pakistani troops started firing with small arms and intense shelling with mortars along the LOC in Degwar sector in Poonch district. Alert Indian troops retaliated immediately and gave a befitting reply. No damage was caused on the Indian side by Pak firing. Army Chief Manoj Narawane earlier had expressed disgrace on Pakistan continuing its nefarious activities along the LOC in times when the world is fighting coronavirus pandemic. A constituent lab of CSIR in Bengaluru, that is CSIR National Aerospace Laboratories, along with MAF Clothing Bengaluru, has developed and certified an overall protective cover-all suit or PPE. Now, this multi-layered non-woven fabric-based cover-all can be used to ensure the safety of doctors, nurses, paramedical staff and healthcare workers working round the clock on to tackle COVID-19. The coveralls have gone through stringent testing at South India Textile Research Association in Coimbatore before being certified for use. CSIR National Aerospace Laboratories and MAF Clothing plan to increase the production capacity to about 30,000 units per day within 4 weeks' time. And Mysuru-based CSIR Central Food Technological Research Institute has made available high-protein biscuits to the COVID-19 patients undergoing treatment in the All India Institute of Medical Science near Delhi. CFTRI has supplied 500 kilograms each of high-protein biscuits and high-protein rusks to the Dietetics Department of AIIMS to supply to the patients. The biscuits were supplied on request from the officials of the institute. These biscuits contain 14% of protein, while usual biscuits contain around 8 to 9% of proteins. Face masks or face covers have emerged as one of the most important tools in fighting coronavirus spread. As the centre makes wearing masks mandatory in public, Jammu's Nagrota has been setting an epitome of safe practices against spread of coronavirus outbreak. A napkin stitching centre in Jammu's Nagrota has been converted into a Khadi masks stitching centre, according to the Khadi and Village Industries Commission. The stitching centre produces 10,000 masks daily. These masks are double layered and are reusable, skin friendly and biodegradable. Along with producing masks, the centre has also helped create employment for many in times of crisis. In neighbouring Nepal, the second COVID-19 patient was discharged from the hospital yesterday. According to the Ministry of Health and Population, the 19-year-old patient returned home after her sample tested positive. Nepal's Prime Minister KP Sharma Oli has congratulated the teenager who spent 27 days in the hospital combating the virus. In the Himalayan nation, out of a total 30 COVID-19 patients who have recovered so far, 2 have recovered so far, while the remaining 28 are under treatment. And in other news, in international news, we get you. Sri Lankan Prime Minister Mahinda Rajapaksa said that the Election Commission has no authority to postpone the general election without fixing an alternate date. In a statement issued yesterday, the Prime Minister said that the Election Commission is required to announce an alternate date for election when it cannot be held on the date fixed by the President. It is noteworthy that general elections were scheduled for 25th of this month but got postponed because of COVID crisis. Election Commission has said that it may not be possible to meet the June 2nd deadline for conduct of elections, but the Prime Minister said that such mandatory legal requirements cannot be ignored on the basis of speculation as to what may or may not happen weeks and months into the future. Citing that China should face unspecified consequences if it was knowingly responsible for the coronavirus pandemic, US President Donald Trump criticized China for lack of transparency after the virus broke out in China's Wuhan province. Trump also told reporters about his doubts on China's death toll, which was revised on Friday. Meanwhile, while stressing on the situation in America, the US President announced that Texas and Vermont will allow certain businesses to reopen on Monday while still observing precautions. However, Montana will begin lifting restrictions early. Although some state governors have warned that they will not act prematurely to reopen their economies until there is more testing. Canada and the United States have agreed to extend border restrictions for another 30 days to help control the spread of coronavirus. Washington and Ottawa agreed last month to clamp down on non-essential travel while allowing trade to continue across their long shared frontier during coronavirus outbreak. Canada's Prime Minister Justin Trudeau said that the agreement is unchanged and he expected shipments of medical supplies such as masks to continue to cross the border. The restrictions were due to expire next week. The death toll in the worst coronavirus affected country, that is US, has risen to 38,664, while over 7.32 lakh people have been affected. In Canada, 1,400 deaths and over 34,000 confirmed cases have been reported. In times of crisis, as the country faces a second wave of coronavirus, China is continuing to adopt strict measures for prevention and control of possible imported and asymptomatic cases of COVID-19 across the country. Chinese health authorities on Saturday said that it received reports of 27 new confirmed novel coronavirus cases on the Chinese mainland, out of which 17 were imported, while no new deaths were reported. As the epidemic situation continues to wane in Wuhan, with authorities in central China's Hubei province downgrading the city's risk level, the city scales up the screening measures to test for asymptomatic infections. Meanwhile, the southern Chinese city of Guangzhou has established various COVID-19 testing points in its 16 hospitals as part of the city's new round of screenings in April. China so far has reported 83,787 cases of coronavirus and 4,636 deaths. As relief aid, an airplane carrying some 14 tons of medical supplies from China arrived in Buenos Aires as the Argentine government seeks to increase its testing capacity amidst the coronavirus pandemic. The airplane, belonging to the state-run Aerolíneas Argentinas, is the first of an expected 8 flights to bring medical supplies, including specialized face masks and face shields. The moves come as the Argentine government has been seeking to ramp up testing before it lifts quarantine restrictions. So far, Argentina has reported 2,758 confirmed cases of coronavirus, out of which 132 have resulted in deaths. Meanwhile, in Italy, 3,491 new coronavirus cases were registered in a day, which was nearly identical to the previous day increase in the confirmed infections. Health Ministry in Italy said that 482 more deaths were registered, raising the overall toll to 23,227. Italy has been one of the worst affected countries, which has Europe's highest number of deaths. The number of confirmed cases has neared to 1,76,000. However, the country is approaching the end of its 6th week of nationwide lockdown, with people allowed out of their homes only for essential work or buying food and tending to family members. Meanwhile, the Spanish government is planning to extend the nationwide lockdown by 2 weeks. Prime Minister Pedro Sanchez said that he would ask lawmakers to extend the lockdown until May 9th rather than lift it on April 25th. The country has been in lockdown since March 14, when the government ordered a halt to most economic activity and imposed severe restrictions on movement. Spain has become the second European country after Italy to report more than 20,000 deaths linked to COVID-19. France has reported 642 more COVID deaths in the past 24 hours, but registered new falls in total number of coronavirus patients in hospitals and intensive care. The new deaths brought the total toll in the country from the epidemic to 19,323. However, in a continuation of a trend seen over the last days, the number of coronavirus patients in hospitals fell by 551 to 30,639, while in the ICU it fell by 194 to 5,833. Now, this was the 4th consecutive day that has seen a fall in the numbers in hospitals. France has been in lockdown since March 17th in a bid to slow the spread of the epidemic. However, President Emmanuel Macron announced this week that the lockdown could begin to be eased from May 11th. Announcing that Israel would ease its coronavirus lockdown in a responsible and gradual way from Sunday, Prime Minister Benjamin Netanyahu said that the move would allow some businesses to reopen and relax curbs on the movement. Israeli authorities have steadily tightened a partial lockdown imposed on March 14th, shuttering offices, closing schools and ordering people to stay mostly at homes. Although under the new rules, the 100-meter restriction will be expanded to 500 meters. Also, open-air prayers in groups of 10 will be permitted. Meanwhile, talking of coronavirus tally, Israel has reported at least 164 deaths and nearly 13,300 cases. However, local infection rates have generally declined over the past 2 weeks, according to the Israeli Health Ministry data. Azerbaijan has also extended quarantine restrictions over coronavirus outbreak by 2 weeks until May 4th. The government also said that the borders with Georgia and Iran would remain closed until May 4th. Azerbaijan, an energy-rich nation in South Caucasus, has recorded a total of 1,373 coronavirus cases with 18 deaths. A Colombian boxer has put his champion belt for auction to help coronavirus victims. Pablo Carrillo won the World Boxing Association flyweight champion belt in 2019. After putting lots of efforts, Pablo said that he will get some funds through auction for needy families. Colombia is currently under a 5-week lockdown to contain the coronavirus, and many families are now cut off from work and are scrambling to make the ends meet. 153 people have been killed in Colombia, while 3,439 are infected. That's it in this edition of the news this hour. Thanks for watching. Namaskar.